Imagine a room filled with people that make decisions about your health. You'll probably think of doctors and researchers, maybe even your parents. But what if they made biased decisions that could alter the way you live your life? What if most of these decisions were wrong? What if some of them cost you your life? That is the scary reality women are at the risk of. A UN global report found that 90% of people have some gender bias against women. But what happens when this gender bias becomes a life-threatening risk? Women's health is a niche area that roughly affects 50% of the population, yet their health concern remained undervalued and underfunded. This bias has found its way into women's daily lives through disbelief of symptoms, workplace harassment, wage gaps, and female feticide. All this combined also results in 72% women having to wait longer periods of time to get their diagnosis compared to men. That's 2.9 billion women that waited to get a life-changing answer from their doctors, while we lose our cool when the pizza delivery isn't on time. And no, this isn't a wait period of an extra 5 minutes. It's more like 4 years on average when it comes to many diseases, and 2.5 when it comes to something as severe as cancer. And in that time, a small cancer cell probably turned into a large tumor. For instance, women make up 80% of the patients affected by autoimmune diseases, such as multiple sclerosis, according to the NIH. And there's about 200 new multiple sclerosis patients each week in just the United States. But the lack of focused research due to gender bias leaves these patients with a high risk of misdiagnosis and inadequate treatment. In fact, according to ANU, women are 75% more likely to have adverse reaction to drugs and 29% more likely to die from it. Another very popular example is the misdiagnosis of heart attacks. And you'd know how grave a heart attack is, A, if you've seen it happen in real life, or B, saw it on a Netflix show like I did. So every time you search up the image of a heart attack, you'll see a man clutching onto his chest in severe pain. And while chest pain is common for both, women are more likely to experience non-traditional symptoms such as vomiting and back pain, but we've never seen that as the portrayal of a heart attack, have we? And the root of all this? Medical gaps in research. Despite the fact that physicians have highlighted physiological differences between men and women, it was found that clinical trials were not designed as such. So don't go on blaming your doctors after this, because they were trained according to the findings of those trials. Some interviewed physicians said that they experienced gaps in training despite knowing that women experience different risk factors, symptoms, and drug responses, especially in neurologic and psychiatric conditions. This has gone so far to the point where a study on the effect of estrogen in postmenopausal women was conducted solely on men. Historically, women were considered tiny men by healthcare providers, and for a long time, no one questioned how absurd that sounded. Which is why women's participation in research now is making more of a tsunami than just a wave of change. Closing the gender health gap is a $1 trillion opportunity, and currently only 1% of research and development is focused on non-cancer related women's health. While having gender equality was something that should have happened yesterday, it's not too late to change the lives of 3.9 billion women. For that, we need policy changes, corporate accountability, innovation grants, and public awareness campaigns. The doctors have to work on getting more medical training and validating women's experiences by not dismissing them as psychosomatic. The educators have to find and teach more recent, inclusive research. The researchers need to design better clinical trials because, let's be honest, this is the 21st century. We won't let you get away with it this time. And you, yes you have to know your body best. That means keeping track of every symptom and its progression, even if it means having to share the most out-of-pocket things with your doctor. And I know there is no single solution for this deep-rooted problem, but no one deserves to hear that they're seeking attention when their life is on the line.